This is ABC 15 Mornings.
Help is on the way, Arizona. From ventilators to masks, even surgical gowns, supplies are arriving from all over to help combat the growing number of coronavirus cases in the state. We'll show you where it's all going.
And it's extremely important to check your mental health during these times of isolation. But how can you ensure that the care that you're getting is legitimate? ABC's investigative unit looks into a local woman whose qualifications aren't quite adding up.
Making wishes come true, even during quarantine. People in the Valley showing up for a 7-year-old who deserves a parade fit for a princess. They gave her just that, and we're going to show you why they showed up for her. This is one of the best stories that you will see today, and we hope that in this time of change that we can bring you a few smiles as we start this Saturday off. I'm Nohelani Graff.
And I'm Mark Thompson, and I'm smiling because I'm working from the comfort of my home. It is a little bit difficult adjusting to all of the different, scripts and prompters and things that we've got going on here. But guess what? Everybody has been making some sort of adjustment during the past couple of weeks or so. But how is the weather shaping up? We got Easter coming up tomorrow, Nohe.
Yeah, that's the truth. I'm jealous because you can start the morning off staying in your socks, and that would be a nice comfy way to start the morning because we do have some clouds out there. It's a little cooler right now as well, and we've got some morning rain chances that I think will continue through mid-afternoon, but then we'll be drying out later this afternoon, and we'll enjoy highs in the 70s throughout the Easter weekend. Right now, temperatures are pretty mild too. We've got a mixed bag of 50s and even low 60s across the valley. Goodyear a little cooler at 54, but a little warmer in Mesa and Glendale in the upper 50s, 58 in Chandler. Also, you can see that band of showers still kind of hanging around in the far west valley over portions of Buckeye, areas of Casa Grande getting a few sprinkles, and up through Lake Pleasant as well. So I'm going to continue to track this storm and show you what our rain chances look like as we head into Easter. That's coming up in just a few moments.
All right, Nohe, thank you. Well, the coronavirus, it continues to claim lives. More than 8,000 people have now died here in the United States, with more than 2,000 in the past 24 hours. But there are some signs that what I'm doing right now, social distancing, it is working. Karina Mitchell, she's got more.
Doctors on the National Coronavirus Task Force saying for the first time since the pandemic began, the number of cases in the U.S. may be leveling off. But health officials warn this is not the time to become complacent. In New York, the rate of hospitalizations is down, and now more people leaving intensive care than going in. Experts say that shows social distancing is working. But concern is rising in some parts of the country, including Michigan and Maryland, where the governor warns they're now seeing a rise in the number of new cases. With millions of Americans out of a job, President Trump announcing he's creating a task force to decide how and when to get Americans back to work. But many raising concerns about reopening the country too soon and before widespread testing is available. Karina Mitchell, ABC News, New York.
Now, here in Arizona, we are bracing for the peak. There are currently 3,112 COVID-19 cases and 97 deaths have been reported. And there is a growing concern in northern Arizona, including the Navajo Nation.
That's right, Mark, and those tribal lands are one of the top hotspots in the country, in fact, when it comes to cases per capita. And now we're learning that the Navajo Nation is also running out of water, a critical resource. The Arizona National Guard receiving word that the area is in dire need of water. And we're also learning that a request has been put in to activate a U.S. Reserves team to help out medical centers.
I agree that they need assistance. They are the community in greatest need relative to the percent of their population in our state.
Now, as for the 57-hour curfew that was placed on the nation this weekend, so it means only essential workers can leave their homes. Also, strict enforcement has been promised. Navajo police are able to issue citations, and that could include fines of up to $1,000 or even jail time if they think it's warranted.
And starting tomorrow, we're going to be able to provide you with a lot more information when it comes to the actual state of coronavirus here in Arizona. New statistics that will become available. That includes the location of confirmed cases by zip code and the ages and gender of those who have passed away, and the race and ethnicity of patients. Additionally, the State Department of Health Services, they'll be providing daily updates about the number of ICU beds available and how many are being used for coronavirus patients.
In the meantime, Arizonans are stepping up to help with this outbreak. Right now, retired doctors and nurses are being recruited to help fight COVID-19. ABC 15's Zach Crenshaw shows us who's stepping up.
I'm Zach Crenshaw. While almost all of us are being told to stay home, some are being asked to do the opposite and return to the front lines. I'm talking about doctors and nurses putting back on their scrubs and going to fight COVID-19. Now, Arizonans are stepping up to do the same if they're called on. Christopher Golda has an essential job.
Monday through Friday, from 9 a.m. to 5.
You're not getting paid a dime?
No.
He's a volunteer with Maricopa County's Medical Reserve Corps. Right now, that means taking phone calls.
The most common call, I would say, is testing.
They want to get tested even if they don't have any symptoms.
June Vetrano oversees the group of about 630 volunteers and counting.
We're getting volunteer requests about 20 to 30 people a day.
It's a diverse group.
So our volunteers are everywhere from the age of 18 to 90.
About 1/3 have medical certifications.
The majority of folks are nurses or retired nurses that are interested in coming back out and helping.
Governor Ducey says they may soon be called on if Arizona sees an influx in COVID-19 patients that overwhelms existing hospitals.
This includes any healthcare professionals who are currently retired but may be able to step in, volunteer, and help.
And lots of different people are stepping up.
One guy called me today is a truck with a pallet jack, a box truck. Do you need me?
They'll use him for supply runs. The medical reserves not running around the ERs just yet.
They are definitely making sure that we're prepared if the need were to arise.
So for now, it means answering phones and questions. And for Chris, who sacrifices 40 hours of his week serving, he doesn't want any of the attention or praise.
Everybody that's out there, nurses, doctors, they're the heroes. We're just a little piece of the pie.
If you're a doctor, nurse, or just interested in volunteering, we have more information on how you can get involved on our website, abc15.com. Zach Crenshaw, ABC15, Arizona.
Zach, thanks for that. And as people in our state continue to fight against the virus, more supplies, additional supplies, they are on the way. In fact, 100 additional ventilators, they are en route to Arizona. They all come from the national stockpile. They'll be sent to areas in need across the state. The supply is still short, though. The state has requested 500 ventilators in total.
Let's talk about that most accurate forecast now. Let me show you the wide view of the state on our clouds and radar. So you can see that we do have some snow showers falling in the high country in the Flagstaff area and kind of that arc of showers reaching over to Lake Havasu City and also starting to bubble up to our south. So our valley planner here right now, we are going to continue to watch those rain chances through the morning hours here. Our sunrise officially happened at 6:02, so that sun is up, but those clouds are sort of obstructing it. We will start to dry out later this afternoon, and we will slowly warm up. 69 degrees by 2 o'clock. So today, if you can, I'd hold off on any of the lawn work because you will be dodging raindrops. But tomorrow, you've got the all clear. We have a slight chance of rain returning on Monday and then dry again on Tuesday. So I'm going to show you the rest of this storm track and also look ahead to that Easter forecast in case you're going to be celebrating at home. That's coming up in just a few moments.
All right, no, hey, thank you. And this is a story that we're all going to love here, new this morning. Showing love for a Make-A-Wish kid. 7-year-old Clara Williams is battling cancer. She was supposed to be heading to Disney World with the Make-A-Wish Foundation, but because of the COVID-19 virus, that's not going to happen. So instead, dozens of cars decorated with Christmas lights, streamers, and balloons all drove by her home in a car parade. Mesa, Chandler, and Gilbert Fire and their police cars, they all drove by her home as well.
Gotta love the setup on the lawns too. I mean, everybody went all out. I absolutely love that. We love you, Clara, too.
Yeah, absolutely. Well, coming up, getting licensed legitimate care, some warning signs to look out for when it comes to your mental health. Welcome back, everybody. It is 6:11 on your Saturday morning, and there is no doubt that COVID-19, it is changing our lives, especially challenging when it comes to our mental health as well. So if you're considering getting some help, it's important to get real licensed care. And that's why this ABC15 investigation that you're about to see, it's really, really important. Dave Biscabine, he spent years investigating unlicensed healthcare facilities, and now he's got more on how you can protect yourself when it comes to your mental health.
This is Dr. Marilyn Wiley. She's claimed to be a clinical psychologist. In this photo, wearing a white coat, blood pressure cuff in her pocket, stethoscope in her hand. But there's an issue. Dr. Wiley doesn't have a license.
I'm not fixed. I'm not better. This is constant suffering, hoping, like she should not be practicing.
Reginald Jackson, his fiance, and 2 sons all saw Wiley. They thought she was licensed.
I saw this doctor for almost a year and a half.
Makes you wonder if everything you've gone through and experienced
and
thought you're doing, was it real?
Yeah, was it real?
Was it legit? You don't know?
I don't.
The Arizona Board of Psychological Examiners confirmed Wiley does not have a license. Records show she applied twice, in 2017 and 2019, but didn't get one. On LinkedIn, Wiley claims a PhD from online Walden University and lists both the American and Arizona Psychological Associations, but both say she's not a member.
How many sessions would you say you've had with her, ballpark?
Between myself and my sons, easily 30 to 40 sessions.
So now you've sent me bills. So,
oh yeah.
So you've been billed.
Oh yeah.
And it looks like insurance has been billed.
Yes.
It's this location in downtown Scottsdale where Wiley worked at Vibrant Healthcare. Reginald provided us with 24 Vibrant bills. The provider, Marilyn Wiley. Sessions for psychotherapy and psychology. These past photos show clinical psychologist written on Wiley's white jacket, door, and desk nameplate. But state law says you can't call yourself a psychologist without a license. In fact, it's a crime to do so.
But you think that they're covered by your insurance, so they're good. And in this case, she wasn't. She is unlicensed. Simple and plain.
Good morning.
There we go. Can you hear me?
Dr. Jared Skillings is with the American Psychological Association.
How important is it for people that are dealing with these types of emotions and issues to seek licensed, legitimate care?
That's a very important question.
And he says now, as much as ever, with people depressed, anxious over COVID-19, and losing loved ones.
I think sometimes the general public doesn't appreciate how much damage the wrong advice or the wrong intervention can have. If you're in a spot where you have a clinical problem, like you're not functioning, you really need to see a professional because you want to do the right thing.
We reached out to Dr. Wiley on the phone and online. She responded on Facebook and called us back.
Can I use this interview on air, your voice?
Wiley refused to let us use her voice on air. But here's a rundown of her side. Wiley admits she doesn't have a license, but denies doing anything wrong. She claims she was working to get training under the supervision of another provider, who she would not identify. Wiley also wouldn't tell us why so far she's failed to get a license. Bottom line, Wiley says she's being targeted by people trying to ruin her career before it gets started. Wiley also recently left Vibrant Health. The company did not respond to our questions.
Yeah.
Reginald says neither Wiley nor Vibrant told him she was a trainee.
Have you filed complaints against Marilyn Wiley?
I have filed complaints with the Arizona board, yes.
After they were filed, she posted this comment on Facebook. Does a fake psychologist have to uphold confidentiality? Good question.
Now, when did you file the complaint?
Maybe early November.
Those 6 months have weighed on Reginald.
It's been pretty much a living hell because you question everything.
Especially when he thinks about the missed signs, like he saw constantly posted on social media.
Is not going to wear a lab coat. They're not going to wear scrubs. They're not going to have a stethoscope. I even had her take my vitals one day before a session.
Really?
Yes. I have no clue. I'm like, why is she taking my vitals?
Have you ever used a stethoscope?
No.
Okay, so that would be irregular if you saw a psychologist posting pictures in a white doctor's coat with a stethoscope.
Using the stethoscope or thinking that you can diagnose heart conditions as a psychologist would be out of scope of practice in every state in the country.
So what's the takeaway here for all of us, for the millions around Arizona and the country now dealing with our new, uncertain reality?
I guess for everybody who's watching this, that do your research.
What you should do is you should go to Google and type in your state and then click verify a license. And the very first thing that you find for every single one of them was the website where you can check that out. So that would be the very first thing people should do.
I'm investigator Dave Biskobing, ABC15, Arizona.
All right, time now.
6:16 now?
Yeah,
Yep.
exactly.
6:16 on your Saturday morning. Yeah, it's kind of hard to communicate because I can't see you back there at the studio, but I know you can see me, and I've got like 3 different monitors going on, but it's fun. It's fun actually working from home and trying to coordinate all this, but big weekend when it comes to the weather, Easter weekend, right?
Yeah, exactly. I know a lot of people have been eyeing that forecast because everybody's having to, kind of change things up a little bit and figure out how their Easter celebration is still going to go on while practicing social distancing like we are. And you know what? I think that tomorrow, it's going to be a great day however you choose to celebrate. Today, though, you might want to get that rain jacket out and just keep it handy. We might be dodging some raindrops, but check out the views that it's creating with all of those storm clouds this morning. Absolutely gorgeous. Live view of the Papagos there. That sun is up, but just barely trying to crack through. But you can see we've got some darker storm clouds here as well. So we do have rain chances in the forecast, about a 40% chance of rain through the early afternoon hours. Then it starts to taper off after lunchtime, but still a 30% chance of rain until we get to about 4 or 5 o'clock. And that's when I think we dry out. So right now we are seeing some showers right along the 303 up towards Anthem here, and also down the Gila River, down near the Gila River Indian community this morning. Also up to our north, we're seeing near Lake Havasu City in the I-40, portions of Kingman, and also Flagstaff getting a few light snow showers. So Futurecast showing us that this storm system is going to continue to sit kind of right off to our west there. It's going to try and creep into the valley. By noon, we'll see a few more isolated thunderstorms pop up to our south. That could still move into the valley as those storms bubble up. We'll see this afternoon a larger storm system near Sedona and Payson that could bring snow and possible chances of isolated thunderstorms. Same thing in Show Low and off to our south, and that system could kind of brush by the valley as well. But then I think after 4 o'clock, we start to clear out here in the valley, even though those storms continue off to our north and our east. Our temperatures right now, because of the snow that's falling in Flagstaff, we are sitting at freezing right now. We're also in the 30s in Prescott. Show Low is below freezing as well. Here in the valley, we're sitting in the upper 50s and low 60s. 58 in Glendale right now, 55 in Goodyear, 56 in Gilbert. But hour by hour, we'll warm up slightly. We're going to be in the 60s for a while this afternoon. Even through 2 o'clock, we're still in the upper 60s, but I do think we'll make our way into the 70s this afternoon and top out at 71 degrees across the valley. Goodyear, Ahwatukee, Mesa, and Gilbert all looking to top out at 71. Same with Fountain Hills. Anthem and Cave Creek, though, likely to stay in the upper 60s. Very similar temperatures off to our west, 76 degrees in Lake Havasu City, 71 in Yuma. To our north, a cooler day, 56 in Prescott, 52 in Payson, same temperature in Show Low. Very similar temperatures in Flagstaff. In fact, it'll be more mild up there, and you'll also see a few breezes around 5 to 10 miles an hour with occasional gusts around 15 miles an hour. Tomorrow for Easter Sunday, though, we're going to see more sunshine. We're going to dry out. We're going to be warmer in the upper 70s. Upper 70s continue into Monday, but we move a slight chance of rain back into the forecast on Monday, and then we dry out Tuesday and Wednesday. And on Wednesday, the 80s look to make their return. And I think we get even warmer by the time the week moves on. There's going to be a little something for everyone in that 7-day forecast. So I'm going to show that to you coming up in just a little bit, Mark.
No, hey, thank you. Homeschooling for the first time can be intimidating for any parent coming up. An expert expands on working with children who have additional challenges.
With campuses closed for the rest of the school year, a lot of families are facing something brand new, homeschooling. But with students with autism, it presents a new set of challenges. So Rachel Anderson is joining us today. She is the Director of Children's Services at Southwest Autism Research and Resource Center, or SARC, as we all know it. Rachel, thank you so much for being with us. So you have 6 tips to help families kind of make this transition at least a little easier. So let's start with your first one, remaining realistic.
So set up expectations for your day and keep them broad. Start with a breakfast time, a meal time, an outside time, a learning time, but don't try and program every last minute of your day. For your smaller children, it might be beneficial to add in pictures to help support what time and what period of the schedule it is. So for outdoor time, you might include a picture of their favorite outdoor space or outdoor activity to indicate what you're going to do during that particular time.
Also, we know a lot of these students thrive with structure, but you're still saying allow for some choice.
If you set a schedule for your child, I think it's important to understand that they might want to do it in a different order, or even something within the activity itself. So for example, a mealtime choice. Perhaps it's time to eat lunch, but you can offer a choice. Do you want to eat inside or do you want to eat outside as a picnic? And that just allows for a little more flexibility within the routine and for the child to elect how they want to engage in that.
Which also leads into your next point, be flexible.
So you might have prepared an entire activity of making Play-Doh and it's going to be fantastic and amazing. The moment you say that, they say, ugh, I don't want to do that. Okay, try something else. It's okay to be flexible and adapt to the day.
As you're doing that, and I think this applies for so many parents, regardless of what stage your child is at, you've got to set goals.
In particular, that surround our unique environment that we're in right now. And it presents us with new opportunities. So for instance, at home, we're doing a lot of dishes. I know I certainly am. And this presents a unique opportunity to work those into some of our goals. So this might be time to work on unloading the dishwasher and putting things away. It might be time to work on sorting laundry and getting the washing machine started. So some of these adaptive skills that honestly, we sometimes don't have time to focus on with our kids because we're busy working on them to this event and this next therapy. But now that we're home, we can focus more on these home routines that really are so important skills.
Also, it's been difficult for a lot of students to get used to being at home and not being in that school environment. So how do you motivate them?
Really hone in on your child's unique preferences and unique opportunities to explore what they really enjoy and use that. So if your child really likes sweet things, baking might be a great opportunity where you're able to incorporate sweet chocolate chips and an outcome of a chocolate chip cookie and incorporate some math concepts. It's a great way to keep kids motivated.
Last one quickly, stay social. That's hard, but important for all of us.
And so that can be within your immediate family that's at home together, but you can also set up opportunities to remain social via technology. So something that I've done and set up for my own child, my littlest one, is I've bought her grandma a copy of a book and she has a copy of a book and they have some reading time together each day electronically. And so she's able to maintain that relationship, but through the technology that keeps everyone safe.
And for parents who do need a little extra help, SARC is staying open at this time and you're still available to clients, correct?
We are offering some enrollment to some of our programs. So we are able to directly support some families during this time. And if you are interested in reaching out, we have an intake team who can help walk you through what's available. Their number is 602-606-9806.
Wonderful. You guys are such a great resource for this community. And certainly at this critical time, I know that will be no different. Rachel, thank you so much for your time today. We appreciate you.
Thank you for having me.